Hi, I'm Neil O'Grady, registered osteopath, and today I'm going to talk about separated shoulder or AC joint dysfunction, or it's a ligament sprain of the ligaments that would connect your clavicle to your acromion and your scapula. So how would this happen? Typically, it could happen with a fall and an outstretched arm, which could separate your shoulder, your AC joint, and could also break your collarbone. Or more typically, a shoulder in a match or rugby, or actually falling off your bike or something and landing on your shoulder, and that can separate your AC joints. Your collarbone could pop up or separate. Okay, so how do we test it? It's called a compression distraction test. There's two separate tests in one. So to do compression, what I will do is I will cup the glenohumeral joint, so the first more or less across the collarbone and across the anterior shoulder, and the back along the scapula, and just fingers over the spine of the scapula. You can interlock your fingers if you like, and what you're doing is compression, so you're squeezing in like that. Okay, a positive test here would be reproduction of pain along the AC joint in the shoulder and excessive movement of the clavicle at the acromion, so your AC, so the collarbone might pop up when you press it like that. Okay, that's a positive compression test. Distraction, what you're doing is you're palpating the AC joint here, so I'm just on it there, and I can grab the distal part of his upper arm, just let the arm hang, and I can do it a couple of ways. I can just traction the arm, we call that direction towards the floor like that, and again, excessive movement and reproduction of pain will be a positive test here. Another way to do this would be what they would term the bad cop test. I might just get you to stand up to me if that's okay. And I get you to turn the opposite way and turn away from all the way around like that. And I'll use this arm just for ease of instruction, okay? So I get you to place your arm in this position like that. You can get the patient to pull their own arm, but I won't. I prefer to do it myself. Again, palpate the AC joint, and what you're going to do is, you can see why it's called the bad cop test, and I'm going to pull the arm or distract the arm like that. Again, reproduction of pain or excessive movement at the acromioclavicular joint will be a positive test. And that, everybody, is the test for compression distraction test for AC joint dysfunction or sprain. Thank you.